I'm gonna greet the solar plexus. I find it, I go up into it, and then I lean my body in for pressure. So you're gonna notice in this session, I compartmentalize a little bit more. We don't just do plain old zone walking, right? So we're now sectioning it off. I go up, I go down, I go here, I meet my hands, right? Up, down. Maybe this, if I wanna get in between the toes. My 4 relaxation techniques. I circle, I swish, I spinal twist, I milk the toes. I'm now going to thumb walk the medial and lateral malleolus. So you guys are gonna see the medial side. We were talking about this earlier. My hand, just like doo-doo. My state of body and mind is important. So I'm not like, doing all these things. I'm really having good use. Because I've been doing this for a long time, I know how to hold this on the backside enough. If you're not holding that, you can't do that. That's gonna hurt toward her knee, sorry. But I know how to hold that backside, or I just hold it here. And now I'm thumb walking this whole medial side of that calcaneus. Right there is the bladder, okay? That's the bladder. That's because that's the ureter, that's the kidney, that's the adrenal gland. So go ahead and come behind me. So you're going to see the bladder here, usually where a puffy patch is. This is ureter, kidney, okay? Kidney, ureter, bladder. Down here, prostate, uterus. Bladder, ureter, kidney. Above the kidney is the adrenal. Okay? Thank you. After I do this side, I scoop under to that side, and now we're on the lateral side. This is hip, hip, hip. This one is, it depends on the body and their ankle and their bones and everything, but I'm really gonna use my body because I don't wanna hurt my fingers by trying to get in there. Right? So I'm gonna use my body, 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 body. All right? I'm going, so there's a couple things. It's very deep. It's very deep. Yeah. It's deep because I'm teaching and I'm excited. But also, when there's pain somewhere, it's an indication that that part of the body may need attention. So now, this is the base of the 5th metatarsal. This is the calcaneus. This is squishy. This is knee. So knee, 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 knee. And I'm going to detail this whole area.
What is that for again?
This is knee.
Oh, knee, I'm sorry. Okay.
This is thigh, so quads, and this is hip. Hip, quads, knee, calf, foot. Yeah. Now, I don't have to go deep. I can pretend I'm not teaching and I'm just listening to tissue, because I'm not really listening to her tissue as much as I should when I'm teaching, because I'm focused on her really feeling it and you really seeing it. So I tend to go deeper when I do that. Sorry. So. Yeah. So it would be more like that. Okay. Now, I could do a little stir of the soup in one direction and the other. Then I'm going to thumb walk that heel. So I'm going to go 1, 2, 3, 4, 5. 1, 2, 3. This is hard tissue to get into. This is the one area you could use your knuckle. You could come down in here, right? After that, you walk the lower pelvic line. And I'm going to walk up zone 1, walk up zone 2, walk up zone 3. I'm just doing the arch. Walk up zone 4. And I walk down zone 5 just because of my body. It's easier. Now I'm passing through lots of good stuff that I just passed through once. Later on, based on what I felt, because I already can feel something in here. So there's gallbladder is talking, liver talking, yeah. So this area, there are these little, do you feel pain in there? Okay, so it's just crunchy. So when something's crunchy and not painful, it usually indicates past stuff, right?
I don't have a gallbladder.
Yeah, so it's past stuff. So when it's not, if it's painful, it's present. If it was pre-gallbladder removal, she might experience pain there. It was removed, so I feel crunchy bits, maybe scar tissue, like this other kind of stuff. But I'm feeling that there was a past, so those crunchy bits are like past, yeah. So I'm working that area. I found something and now I'm working it. Like you found a knot, you work it out. After I work something for a second, because I kind of was going deep in there, I'm going to kind of just give that nice floaty way of just being with her foot, so it's not hard the whole time. I'm going to go in because I also felt something at the level of the adrenal, so I'm going to go into the adrenal. When we do this right now, this is what you're going to be doing. You're going to do the regular passes, and then you're going to return to stuff that you think you felt something, right, in those areas. I'm going to walk the diaphragm line. I'm going to walk up the first metatarsal head, down in between. We did this earlier. Up, down in between, up the third, etc. And again, I would not be going this deep. If it was in session, it would be more like. So it's a different energy if I'm really listening to you. Yeah. So you see what I'm doing? I'm constantly going back and forth between that thumb walking, where I'm going up and down, traversing the vertical zones, and then I'm walking horizontally on guidelines. I'm noting where I felt crunchy bits or maybe pain or tension, and I'm returning there. And then you would move on to the toes, which I won't do right now, but you would do the toes. And right away I found something in there, so that's something I'd return to. So we end up doing all the toes. And then what I will do is I will talk you through certain areas just to kind of get you hip, to really remember the ones that I said are more, you're more inclined to have people ask about. And that's going to end up being the hips, the knees, the adrenals, the shoulders, the mid-back, like all that kind of stuff. Digestion. We're not going to do the second foot. I'm just, don't want you to be totally uneven. Okay, so, and then you're going to end with traction and solar plexus. Hold. Got it? Yeah. All right, good.